10 COVID myths that are now debunked. In the past few weeks, a series of analyses published by highly respected researchers have exposed a truth about public health officials during COVID. The New York Post report said, much of the time, they were wrong. To be clear, public health officials were not wrong for making recommendations based on what was known at the time. That's understandable. You go with the data you have. But they were wrong because they refused to change their directives in the face of new evidence. When a study did not support their policies, they dismissed them and censored opposing opinions. In the final analysis, public health officials actively propagated misinformation that ruined lives and forever damaged public trust in the medical profession. Here are 10 ways they misled us. Misinformation number 1. Natural immunity offers little protection compared to vaccinated immunity. A Lancet study looked at 65 major studies in 19 countries on natural immunity. The researchers concluded that natural immunity was at least as effective as the primary COVID vaccine series. In fact, the scientific data was there all along, from 160 studies, despite the findings of these studies violating Facebook's misinformation policy. Since the Athenian plague of 430 BC, it has been observed that those who recovered after infection were protected against severe disease if reinfected. That was also the observation of nearly every practicing physician during the first 18 months of the COVID pandemic. Most Americans were fired for not having the COVID vaccine. A lot of people already had antibodies that effectively neutralized the virus, but they were antibodies that the government did not recognize. Misinformation number 2. Masks prevent COVID transmission. Cochrane reviews are considered the most authoritative and independent assessment of evidence in medicine. And one published last month by a highly respected Oxford research team found that masks had no significant impact on COVID transmission. When asked about this definitive review, CDC Director Dr. Rochelle Walensky downplayed it, arguing that it was flawed because it focused on randomized controlled studies. But that was the greatest strength of the review. Randomized studies are considered the gold standard of medical evidence. If all the energy used by public health officials to mask toddlers could have channeled to reduce child obesity by encouraging outdoor activities, we would be better off. Misinformation number 3. School closures reduce COVID transmission. The CDC ignored the European experience of keeping schools open, most without mask mandates. Evidenced by studies conducted in Spain and Sweden show that transmission rates were no different. Misinformation number 4. Myocarditis from the vaccine is less common than from the infection. Public health officials downplayed concerns about vaccine-induced myocarditis, or inflammation of the heart muscle. They cited poorly designed studies that undercaptured complication rates. A flurry of well-designed studies said the opposite. We now know that myocarditis is 6 to 28 times more common after the COVID vaccine than after the infection among 16 to 24-year-old males. Tens of thousands of children likely got myocarditis, mostly subclinical, from a COVID vaccine they did not need because they were entirely healthy or because they already had COVID. Misinformation number 5. Young people benefit from a vaccine booster. Boosters reduced hospitalization in older, high-risk Americans. But the evidence was never there that they lower COVID mortality in young healthy people. That's probably why the CDC chose not to publish their data on hospitalization rates among boosted Americans under 50, when they published the same rates for those over 50. Ultimately, White House pressure to recommend boosters for all was so intense that the FDA's 2 top vaccine experts left the agency in protest, writing articles on how the data did not support boosters for young people. Misinformation number 6. Vaccine mandates increased vaccination rates. President Biden and other officials demanded unvaccinated workers, regardless of their risk or natural immunity to be fired. They demanded that soldiers be dishonorably discharged and nurses be laid off in the middle of a staffing crisis. The mandate was based on the theory that vaccination reduced transmission rates, a notion later proven to be false. But after the broad recognition that vaccination does not reduce transmission, the mandates persisted, and still do to this day. A recent study from George Mason University details how vaccine mandates in 9 major U.S. cities had no impact on vaccination rates. They also had no impact on COVID transmission rates. Misinformation number 7. COVID originating from the Wuhan lab is a conspiracy theory. Google admitted to suppressing searches of lab leak during the pandemic. Dr. Francis Collins, head of the NIH, claimed he didn't believe the virus came from a lab. Ultimately, overwhelming circumstantial evidence points to a lab leak origin. The same origin suggested to Dr. Anthony Fauci by 2 very prominent virologists in a January 2020 meeting he assembled at the beginning of the pandemic. According to documents obtained by Bret Baier of Fox News, they told Fauci and Collins that the virus may have been manipulated and originated in the lab, but then suddenly changed their tune in public comments days after meeting with the NIH officials. The virologists were later awarded nearly $9 million from Fauci's agency. Misinformation number 8. It was important to get the second vaccine dose 3 or 4 weeks after the first dose. Data was clear in the spring of 2021, just months after the vaccine rollout, that spacing the vaccine out by 3 months reduces complications rates and increase immunity. Spacing out vaccines would have also saved more lives when Americans were rationing a limited vaccine supply at the height of the epidemic. Misinformation number 9. Data on the bivalent vaccine is crystal clear. Dr. Ashish Jha famously said this, despite the bivalent vaccine being approved using data from 8 mice. To date, there has never been a randomized controlled trial of the bivalent vaccine. In my opinion, the data are crystal clear that young people should not get the bivalent vaccine. It would have also spared many children myocarditis. Misinformation number 10. 1 in 5 people get long COVID. The Centers for Disease Control and Prevention claims that 20% of COVID infections can result in long COVID. But a UK study found that only 3% of COVID patients had residual symptoms lasting 12 weeks. It's often normal to experience mild fatigue or weakness for weeks after being sick and inactive and not eating well. Calling these cases long COVID is the medicalization of ordinary life. What's most amazing about all the misinformation conveyed by CDC and public health officials is that there has been no apologies for holding on to their recommendations for so long after the data became apparent that they were dead wrong. Public health officials said, "You must," when the correct answer should have been, "We're not sure." Early on, in the absence of good data, public health officials chose a path of stern paternalism. Today, they are in denial of a mountain of strong studies showing that they were wrong. At minimum, CDC should come clean and the FDA should add a warning label to COVID vaccines, clearly stating what is now known. Thank you so much for watching. If you enjoyed it, please give it a thumbs up and subscribe to my channel for more content like this. And don't forget to hit the notification bell to be notified of future uploads. If you have any questions or comments, feel free to leave them down below, and I'll do my best to respond to them. And as always, stay tuned for more videos coming soon.